largest Medicare Advantage provider even said in its most recent report that a major reason for their increase in revenue between 2021 and 2022 was in fact the growth of Medicare Advantage. This chart speaks volumes about the burgeoning profits of Medicare Advantage plans, in part because of the denial or delay of care. Insurers are, in effect, denying Americans necessary care in order to fatten and pad their bottom lines, and that phenomenon is unacceptable. The information that this subcommittee has uncovered so far and that we will hear today demonstrates the need for additional investigation into the practices of these powerful insurance companies. And I want to put these companies on notice. If you deny life-saving coverage to seniors, we are watching, we will expose you, we will demand better, we will pass legislation if necessary, but action will be forthcoming. Today, we sent bipartisan letters to the nation's largest Medicare Advantage insurers, UnitedHealth, Humana, and CVS Aetna. They collectively cover more than 50% of Medicare Advantage beneficiaries. We are asking for internal documents that will show how decisions are made to grant or deny access to care, including how they are using AI. Our nation's seniors should not have to fight to receive medically necessary care. I look forward to hearing from today's witnesses. I want to thank each of you for being here because each of you has an important aspect of this story to illuminate. And again, I want to thank the ranking member for his involvement and contribution and turn to him now for his comments.
Well, thank you, Mr. Chairman. I want to welcome you to the Permanent Subcommittee on Investigations. This is a long bipartisan tradition of uncovering waste, fraud, abuse, and outright corruption. The subcommittee's previous work brought much needed transparency to the public, and I look forward to continuing that tradition with you as the new chairman. I guess what I'd like to do is enter my prepared remarks in the record and just speak extemporaneously here. The hearing today is going to be focusing on what I would consider an issue caused by a third-party payer system. When I was in the private sector, I would be renewing my insurance coverage year after year. And it was amazing how every year I'd have to be talking to the insurance agent, okay, now what's being excluded this year? It just never made any sense. But that's what insurance carriers were trying to do, is they would try and exclude things based on the actuarial tables to try and limit the cost of the insurance. And we see the exact same phenomenon when insurance carriers, in this case Medicare Advantage carriers, are trying to limit the abuse potentially of some services. And so they get into this pre-certification process. But I guess what I would argue, it's the way we'll probably address this is, again, through some kind of government bureaucratic action, which I would say probably is not going to work. Part of the problem here, again, is a trend over time where we've pretty well removed the benefit of free market competition from healthcare. I was trying to point out there are two areas of our economy that we are habitually dissatisfied with: healthcare and education. They're largely monopolies. We've driven the benefit of free market competition out of them. And just to reiterate what free market competition does, it generally guarantees, it's not perfect, but it generally guarantees the best possible price, the best level of customer service, the best quality of service. I mean, that's what a free market does. We're not getting that in Medicare Advantage necessarily. We're not getting that oftentimes in education. I do have the chart right here. Shows you the trend over time. If you go further back in time, this is even more stark, but these are numbers are pretty solid. So back in 1949, 68 cents of every dollar in healthcare was paid for by the patient, and 32 cents was paid by some third-party payer, primarily back then some kind of insurance system. Now, only 11 cents of every healthcare dollar is paid for by a consumer, and 89 cents is paid for largely by government or by third-party payer insurance companies. And when you have consumers not worried about the cost of things, prices go out of control. If we had the same system, for example, operating in food, we'd all be eating filet mignon every night. Or in autos, we'd all be driving Maseratis. So we need to look at the root cause, and the root cause of this problem, truthfully, is we've driven consumerism out, which has then driven insurance carriers to have these pre-authorization programs, pre-certification, and they're always far from perfect. So, yeah, I'm going to try and continue in this subcommittee to focus on the root cause and actually fix these problems rather than always be looking at very expensive Band-Aids. And we've got a lot of problems. I think the COVID, the pandemic exposed an awful lot of problems within our medical establishment, within our federal health agencies who've been captured by big pharma. Talking to the chairman, I think there's an awful lot of agreement we have. I'm highly concerned about the negative impact of pharma companies spending billions of dollars capturing our meat as they've captured our health agencies as well. So I truly hope that moving forward here, fully support what we're doing here in this hearing and taking a look at the abuses of the pre-certification process and denials of necessary treatment in Medicare Advantage, but there's so much more we have to look at. And I really hope that we can work together in a nonpartisan fashion because these are problems we need to fix for the American public.